Kegiatan kali ini berkaitan dengan social history. So, the social history is an important aspect that you need to learn in the English for Medicine classroom, especially when we are preparing for the online medical consultation practice. Here, why the social history is important. As Bickley said, questions relating to the personal and social history should be woven throughout the interview. They allow you to identify contributory factors to the patient's illness and help you to evaluate the patient's sources of support, likely reaction to illness, coping mechanisms, strengths, and fears. Gitu ya. Jadi memang social history adalah bagian penting selain dari um, past medical history atau family history gitu ya. Jadi kadang-kadang kan memang sakit itu berkaitan dengan what you do in your daily activity, atau kadang-kadang juga sakit itu berkaitan dengan uh, is the relation with your family or heredity like that, or what you have had in the past like that. Oke ya. Nah, disitulah makanya social history itu bisa menentukan patient source of support, apakah pasien nantinya bisa mendapatkan dukungan dari keluarga atau orang-orang sekitar, atau kemudian juga reaksi si pasien itu terhadap rasa sakit gitu ya. Terus bagaimana untuk menanggulangi rasa sakit atau penyakitnya gitu kan. Kemudian kekuatan dan kelemahan dari si pasien itu sendiri. Nah, itulah mengapa social history sangat penting. Nah, di social history sendiri itu ada 3 bagian, yaitu occupational health, kesehatan kerja gitu ya. Kalau kita mungkin biasa tahu ini istilahnya K3 gitu ya. Kemudian lifestyle, itu gaya hidup juga mempengaruhi, makanya ini masuk social history. Kemudian environmental health itu lingkungan itu gimana gitu ya. Karena tadi di slide sebelumnya dijelaskan sources of support, likely reaction to illness, coping mechanisms, strengths and fears itu ya. Sangat menentukan bagaimana seorang pasien bisa untuk melewati masa sakitnya. Nah, ini tadi social history ada 3 tadi ya, kaitannya occupational, lifestyle, sama environmental. Gitu ya. Oke. Nah, ini kenapa bagian ini penting? Because based on the textbooks of physical diagnosis, in the US, an estimated of 50,000 to 70,000 deaths per year are caused by occupational factors, and more than 350,000 per 95,000 new cases of occupational disease are recognized every year gitu ya. Jadi sakit yang diakibatkan oleh pekerjaan atau aktivitas di pekerjaan itu ternyata nggak bisa dianggap enteng gitu ya. Ada 50.000 sampai 70.000 kematian per tahunnya. Itu di Amerika. Belum ketahuan, kalau saya belum baca informasi kalau di Indonesia bagaimana. Gitu ya. Dan faktornya itu karena pekerjaan ya. This disease involves certain or every organ system, and one of the most important barriers to the accurate diagnosis of occupational and environmental disease is the long latency between exposure and appearance of the illness or ignorance concerning occupation-related health problem. Gitu ya. Jadi sakit yang diakibatkan di tempat kerja itu salah satunya karena terlalu lama untuk tereksposur, terpapar begitu ya, terpapar terlalu lama, misalnya di tempat kerjanya terlalu gelap, mungkin pasien bisa mengalami sakit mata atau mengalami rabun gitu ya. Nah, itu. Appearance of the illness or ignorance concerning occupation-related health problem. Jadi terlalu diabaikan, misalnya ruangannya terlalu sempit atau terlalu banyak debu begitu ya. Jadi, terus diabaikan, akibatnya mengakibatkan sakit bagi si tenaga kerja itu sendiri. Nah, ini beberapa jenis pekerjaan. Ada airport baggage handler, cleaner, coal miner, construction worker, farm worker, healthcare professional, keyboard operator, manual worker gitu ya. Ini beberapa pekerjaan yang bisa aja menimbulkan sakit gitu ya, atau risiko berpenyakit gitu ya. Seperti misalnya cleaner itu tukang bersih-bersih. Tukang bersih-bersih setiap hari berkaitan dengan bahan-bahan zat-zat kimia pembersih, kemudian juga debu, kotoran, sampah begitu ya. Jadi rentan untuk terkena penyakit. Oke. Nah, mungkin dari sini saat interview you can create a questions related to the job or occupation. The first question you can ask to your patient is, what is your job? What is your occupation? Nah, itu tentunya sangat dasar banget untuk bertanya ke pasien. Nah, sebaiknya dokter juga menelisik lebih jauh tentang tentang apakah ada hubungan antara tempat kerja atau pekerjaan dengan sakit yang dialami si pasien, gitu ya. Nah, jenis pertanyaan yang mendetail itu bisa kita simak di listening berikut ini. Ini ada sample of conversation between a GP. A GP is general practitioner, and Mary Steven. Mary Steven is the patient. So listen careful.
I'm now going to ask you some questions about your job. What type of work do you do, Mary?
I'm a cleaner at a big hotel in town, part-time.
Uh-huh. If you could just describe your work for me?
Well, it's much the same as any other cleaning job, I'm afraid, Doctor.
I understand, but it's important to know this to give me an idea about why you're suffering from these asthma attacks all of a sudden.
All right, I'm generally on bedroom duty. I suppose I clean about 15 bedrooms on average every morning.
Mm-hmm. And are you exposed to any toxic products at work?
Toxic? I don't know if they're toxic or not. They're regulation cleaning products, so I imagine they're okay. As I said before, I've only had problems with the attacks recently. I've been using the same products for a couple of years now. I tend to get the attacks when I'm at home anyway.
Has anyone in your household ever worked with hazardous materials that could have been brought home?
No, don't think so. My husband's not working at the moment anyway.
I see. What about where you live, your environment? Do you live near any factories that give off potentially hazardous fumes?
No, there's no factories around our way, Doctor.
How do you and the family spend your evenings, Mary?
You know, the usual. Telly, read sometimes. But then most of the time I have my little girl to take care of. She's still on chemo, so I'm up at the hospital most nights.
How are you coping?
Well, it's not getting any easier, I'm afraid.
And your husband? Your children?
Oh, Pete's got a boys on the new hobby. It's good for them to do something creative and it keeps them occupied. Stops them thinking about their little sister. But then, I think he does it for himself, really.
What's that then?
Making model planes. You know, those kits you can buy with all the fiddly little pieces.
Oke, demikian tadi listening antara GP atau General Practitioner dengan Mary Steven. Nah, as you listen, the GP made some detailed questions. What are they? Nah, ini nanti bisa kalian cari tahu apa aja yang ditanyakan oleh si dokter tadi. Dokter tadi mungkin bertanya tentang hal-hal detail terkait dengan pekerjaan si Mary Steven. Nah, silakan cari tahu pertanyaan-pertanyaan yang diajukan oleh si dokter. Oke, demikian kali ini untuk belajar kali ini. Semoga bisa dipahami. Sampai jumpa di pertemuan selanjutnya.